Yeah.
Over there, that's why.
Welcome back to Kalkstein Chiropractic. I'm with Kristen today, and Kristen, you're the niece of Lisa, right?
I am.
Yeah. Lisa's our front desk lady, and Kristen came to see us, I think 6 months ago or so.
Sure.
It's been a little while,
Yeah.
and you were coming in with mid-back, upper back pain when you first came in, some neck pain as well. And we were treating you in the beginning with adjustments, some soft tissue work. You responded well to that, and then we progressed into some dry needling as well. I don't have your chart in front of me, but you were coming in, I think in the very beginning, once, maybe twice a week, and then we progressed to once a month pretty quickly. You're a student, you've got a busy schedule, so you come in around that time. You work full time as well, so you come in once a month to get adjusted, once a month to get the dry needling when you come in. And today we're going to do an evaluation on you and look at the way you move and do a re-exam, okay? I've got Jordan in the office with me. Jordan's hanging out in the corner. It's early in the morning. Jordan's like, no, not camera ready right now. I'm not going to be on the camera, but we're going to somehow sneak her to be on there.
You have to.
What?
In the background.
In the background.
I'm holding my clipboard up.
Yeah. She's got her clipboard up. So before we get started, can I just ask you a couple questions about your experience?
Sure.
So when you came in, what were you expecting coming to a chiropractor?
Nothing much, just like for you to readjust me. I didn't expect like all the extra stuff and the exercises and the dry needling to be an option.
Sure. So, and I think that she brings up a good point in terms of going to a chiropractic office and understanding some of the modalities that we can offer, or even a physical therapist office, or anyone that does manual work in that sense, right? I think our office is unique in that way, but when she came in, she's used to seeing a chiropractor that solely adjusts her, and there are definitely chiropractors out there that do that, and that do a great job of that, and that provide that service really, really well. We like to be a little bit more integrated. We want to offer different things because that's our practice model. We find that a little to be more effective, and the patients seem to really like it, and all of our goals are with you in mind, honestly. So she wasn't expecting that, and what she means by that is like exercise, dry needling, me to do soft tissue work, right?
Mm-hmm.
For you to have a little bit more in-depth evaluation when you come in, and I think that is a unique experience here at our office in Towson. So. You had that expectation coming in, and then it changed. How have you progressed? How have you felt through your time getting treated with us?
I felt great.
Cool. Okay.
Yeah.
Awesome. And that's what we want. We want you to feel a lot better. We want you to be able to do things outside of here, right? And we talk about that all the time about activities.
Yeah.
She's an athlete. She played softball, right?
Mm-hmm.
You were a pitcher? No.
Sure.
Sure. You were
I was
a pitcher?
all over.
You were all over.
Well, it was mostly soccer.
Okay, gotcha. And so she played sports, and she's getting back into it. You talked about maybe doing some intramural stuff in the past,
Mm-hmm.
And that's awesome. We really want you to, we encourage that type of thing. And I definitely have that conversation with my patients about, hey, what do you want to do? What's fun for you?
Mm-hmm.
Let's get you back to doing that. Let me just be a part of that process to get there. All right, so let's go ahead through the evaluation. Enough talk. Go ahead and face me and relax. And the first thing I'm going to do is do a postural exam, okay? When I do a postural exam, these are areas that I'm looking at and why. At school, I was like, why are we doing this postural exam? What's the point of this? Well, pain can put us into position. Tension can put us into positions that alter our structure, which in other words, alters our function. So the way we stand has a direct correlation to how we move. The way that we position ourselves has a direct correlation to how we feel. So that's important to me. I want to know how my patient is presenting just standing, right? It gives me a good baseline to look at from my previous experiences with the patient. So that's part one, postural exam. So I'm going to look at her, and I'm going to take a look at you from the head down, okay? When I do this, and when I make these things and call these things out, these are temporary positions that you're in right now. This is always changing. So if I say you have a high left shoulder, that doesn't mean like for the rest of your life you've got a high left shoulder.
Yeah.
No, it's functional. It's a part of a moving process of the system. There's a lot of things that make your shoulder raise up like that. It could be stress from a week worth of long test, or it could be an injury to the shoulder, right? Mm-hmm. So a lot of things can do that. So I just like to keep those in mind. So slightly high left shoulder. Good. Slight head tilt to the left. hips equal. So I'm looking for external rotation of the hips. I'm looking at her knees to see if she's hyperextending or if she has both flexed. Are they equal? She's standing about equal. She has a slight extension in the hips. It tells me how she's balancing herself. She's not sending her gravity over her hips as much. She's locking out her legs to give herself a little bit more stability while she's standing with me. So that's something that I can say, okay, hey, hip stability is something that you could look forward to do in the future, potentially, right? I want to go down that path. That's just a quick eyeball look. Good. And then I look at the hips and I'll find the top of the iliac crest and I'll look to see if there's unevenness between the two hips. She has a slightly high left hip. She could be standing with a little bit more extension and rotation on that opposite side. That could be slight. I'll take a look at that when I look at her low back a little bit more. So now I want to watch the way she moves her neck, okay? So I went from head, ears to shoulders. Looked at the creases of her elbow to see if she has more flexion or extension in one of the elbows. I looked at her hands to see if she's pronating or supinating more or less in one arm than the other. And these are quick glances. There might be a slight thing here or there, but if anything's pronounced, if anything's really drastic, that's what I want to pick up on because that's a little bit easier to compare to the last time she was in. Okay, and then I was looking at her hips, I was looking at her knees to see where they're placed, to see if she has hyperextension or extension or flexion in one or the other. I looked at her feet to see if she's rotated in or she's rotated out, if she's externally rotated or internally rotated. I did that opposite. Internal, external.
Yeah.
Yeah, cool. So now I'm looking at range of motion, okay? And for the neck with range of motion, we're gonna go through right rotation first, okay? So as best you can, turn to your right as far as you can go. Good. This is active range of motion. Really good, healthy range of motion, quality movement, okay? There's a little tension I notice in this left shoulder when you rotate away from it. The levator, scap, and trap, that complex is a little tighter on that side. What-handed were you when you pitched?
Right.
You're right-handed. So sometimes with pitchers or volleyball players, their opposite shoulder is the point of stability for their back, and that area can get a little tight. So that's something I can look at from something from the past. Then I'm going to have you rotate to your left. Good. Even better going to the left. So a little bit more range of motion to the left. I want to work on that right rotation. So that would be something I would say full range of motion to the left, right rotation 45 degrees. Okay? So full range of motion, cervical spine, ideal I think is 60 degrees. What is it? 80. It's 80 degrees. Sorry about that. That number fluctuates depending on who is in front of me. That's such a drastic number for a kid. It could be like 120, right? They're like owls. They can move their neck all the way around, and some females are like that as well. And for someone that's an older adult, it might be like 30 is their normal. Okay, so to me, it depends on who you are, really. Extension for me, head all the way back. Is there any pain when you go back like that? No, bring your chin down to your chest. We go by the distance away from their chest. So 2 fingers in flexion, full range of motion and extension. Any pain when you come down with your chest?
No.
Awesome. So I'm going to take you back. I'm going to challenge your neck a little bit differently. So take your head back for me. Good. I'm going to rotate you very gently this way. Good. I'm gently going to press down. Is there any pain with that?
A little bit over here.
On this left side, you feel a pulling in the front of the
Yeah.
neck is what you're saying? Okay.
Yeah.
And then I'll have you come this way. So I would call that right anterior, I would just call it the platysma or the SCM. Those are the muscles in the front of the neck that can get aggravated. Is there any pain when I bring you here and I press down?
No, just that pull a little bit.
So both sides, she has a little bit of pulling in the anterior portion of the neck. That's something I can work on with my hands, get you moving a little bit better that way, very comfortably. This is a really delicate area. I do it very lightly, and that can really actually open up the way that someone's neck moves. Feel a lot better. So I did extension and flexion, rotation, right? Sometimes I'll go in and I'll do lateral flexion, especially if I'm seeing a complaint in the shoulder. So I'll have you bring your head over to the side. Good. Any pain with that?
Just tight.
Just tightness here. Okay, and then come to this side. And I'll compare side to side. So she's a little bit more restricted on this left side when she goes away from it. She might feel a little bit more of a pull, or she might feel that pull happen a little earlier in the time that she moves. Those are things I'm looking at. That's really detailed, I know, for range of motion in the neck. All that, I really want to see the components of her neck as she moves, so how she moves. So if I have someone that says, okay, rotate to your right, and they do this for me, they're not doing a good job of rotating in their upper cervical spine. They're avoiding those joints by doing one of these, right? They're using their whole neck to globally rotate. That would be something that I would look at. I would want to fine-tune my focus on that neck area, okay? And then quality movement in general with extension. Is she lifting with her chest, or is she just doing this with her upper neck? Is she only moving from her cervical spine and up? Can she not lift with her chest at all? Does she not lift her neck back? And does T1, T2, T3, those upper thoracic spine, those have to go into extension as well? Are they not moving? Is she restricted there? And just knowing from her and working on you in the past, that's something that we work on. We work on that upper back area, right? That's a common complaint area just because of the transitional nature of the spine. Normal to get tension there, but there's ways that you can get relief too. So, all right. So we went through a cervical spine range of motion. She has no neurological deficits. She has no neurological symptoms, pain, tingling, numbness down the arm. I don't need to spend my time in here doing a neuro exam on her upper extremity, right? So I'm going to not do that in that case because it's not warranted clinically. As well as this is a re-eval. I'm going back and I'm re-evaluating things that I've evaluated in the past. So it's not necessary for me to do those things. If she had positive signs in the past and she came in here, and they came back for a reevaluation, then I would do them, okay? So I hope you get a little bit better understanding about how I'll go through a simple range of motion posture evaluation for the cervical spine. Now we can go through and tell you how I palpate it and how I work through the areas of the spine, okay? Jordan is very needed, and this is a simple exam for a reevaluation patient. So I'm going to let her get back to work because we're really busy. Dr. Jeff's probably like, where the heck is she right now? Probably. But Jordan, I appreciate you, and I just wanted to bring you in here just so we could hear your voice in the background. That was really nice. It was good quality voiceover work.
Thanks.
You're welcome. You have an awesome day, Jordan. Okay?
Thanks.
All right, let me show you how I palpate her neck and how I adjust her neck. And then we've been dry needling your upper back, and we're going to go back to doing that today as well. If you're comfortable with that, I think that'll really stay helpful for you in that tension. So come up on your back. She works really hard. She works a full week all the way on your back for me. Okay, so I'll talk this exam and this treatment. I'm going to talk a little bit more than normal. Okay, and then in the future I'm going to get away from talking so much because I get distracted a little bit. But I'll explain as I move here, and it slows me down a little bit, really. But I'll explain as I move through here. Okay, so as I come into C0, C1, I'm palpating lateral flexion side to side. So if she guards in that motion, she's guarding a little bit over here. I don't get a true evaluation of how that joint is moving. I have to be light with my hands. It's a very gentle procedure in terms of just palpating the joints in the neck. So motion palpation is a skill that you can really fine tune, but having soft hands really is helpful. So I'm reassuring her with my hands that I'm not pushing, but I'm gently gliding, and I'm assessing how C0, C1 laterally flexes to the right. I have my fingers on the joint, and I'm pushing in gently as I palpate down the spine. Mark Charette taught me a way to palpate the spine. It's extension, rotation, extension, lateral flexion, and rotation at each level going down. So let me show you how I would do that at C0, C1. Can I lift your head up just a little bit so you can get your hair out?
Sorry.
Yeah, you're okay. So I would cup my hands right underneath the occiput here. I have her trust in my hands, right? Trust my hands here. Let your head just fall. Good. I feel the weight of her head fall. Now I know she's really letting go. So extension, lateral flexion, rotation. And I'm just gliding down the cervical spine. She's a little restricted at C0, C1, so right at the occiput. She can probably feel a little tension on my fingers right here. If I push in a little bit more, she's got a little bit of a trigger point. She's got a little bit of a reflex in the muscle. When I apply pressure, it causes a little twitch response in the tissue. On her right side, she's a little bit more fixated down towards C6, C7, and T1. So when I come into that area, that's where I feel the restriction, especially in lateral flexion, okay? So that's the joint side of things. Then I'm going into the muscles and I'm palpating the muscles. There's a lot of fibers that come up and attach to the base of the occiput. The trap has fibers that go into that area. There's techniques surrounding just working on those fibers. I definitely look at them. It's important to understand and feel tension there, but that's not the only thing that I treat. So at C0, C1, a little bit more medial. So some of those muscles that are considered suboccipital muscles that attach closer to C1 in the base of the occiput, she has some tension in that area. So I'm just going to do some light soft tissue work and then I'm going to adjust her. Turn your head to your right for me, Kristen. Tuck your chin nice and easy. Good. Come back. Take a breath in. Easy exhale. Turn your head to your right. Good. And you'll feel that tension build up. Let it go. There you go. Good. So this area, when I work on it, I want you to watch how I wait a little bit towards the end. Here, she still is controlling her neck motion in some regard. She has tension in her system here. Just a little bit. She's just holding on a little bit. Really let go for me as I bring you down into this last little bit of motion. That's where I get a good response to the tissue and I can really take it and get a good active stretch in that area with my hands. So now I'm going to adjust you right here, okay, Kristen? Keep your shoulders nice and relaxed. I make sure that my finger is hovering right below the occiput here. I'm very calm with my hands and I'm waiting until I know where the end range is. So once I have that joint locked out, and I can adjust. Good. And it's not forceful, it's calm in the sense that I'm not really whipping her neck around. I'm at the point where the joint needs to be adjusted and I gently do it. So remember what I said, C6, C7, T1, she's got a little bit more lateral flexion component restriction. Get loose here. Good. So when I adjust, I'm pulling and rotating at the same time to get that lateral flexion component. How'd that feel?
Good.
Okay. So we're gonna go ahead and get her set up on dry needling. You guys can watch that too. And we'll show you how I dry needle her upper back and her mid-thoracic spine through here. Okay? So we're going to work on Kristen's low back today, as well as her upper back. She said within the last week, she's had a little bit more tension in her low back. She'd like us to work on it while we're working on her upper back. I think that's totally okay. She has tension in some of the rector spinae groups and her lumbar spine, and we're going to focus on that area. For her upper back, that tension that I noted in her left trap is what we're going to work on, as well as T1 to T6. That's the area that she's had her complaints in the past, and the areas that we've been working on.
All right, Wes, I think we're ready to get to the superset. So first you have the feet elevated on the ball push-up. Then I'm going to get you set up for your squats and your anti-rotation. Sets of 8 today, Wes. Set 2? 2 sets of 8, yep. What's up, Jim? She's in the zone. Good, Wes. Now we got the box squat.
Really good, babe.
You never felt this better.
This is what this is our apartment.
How are you?
Mackenzie.
Keep the shoulders rolled back, West, chest nice and proud, looking straight ahead, nicely done. A little buffer.
So she's coming down, we barely tap this.
Perfect height for you.
Kristen, you comfortable?
Nice job.
You see me manipulate the needle a little bit more in that spot. Just a trigger point. I'm working on. I can feel it switch.
Thank you.
On that right track.
Yes, sir.
Yes. This one, the needle is.
Just hovering. Roll back just a little bit more. There you go. Nice shot. Right, so you can just set your stuff up on the counter over there, use those hooks for your bag if you'd like. When you're working right up at this bar. So, you can tell me you have some pain going up. So just paying attention to how you feel right now, some of your baseline for comparison after we do this movement, we're going to do another reevaluation. So, first movement we're going to do drives, low back extension is what we're going to do. After we're going to lower back, so we're going to go against this pad here. Walk your feet out slightly so you can lean into the pad a little bit easier. Don't be going down to your sides like so. So this is the starting position. From here, we take a big deep breath in. My exhale, falling back over this bar. So I'm really focusing the movement to my lower spine. I'm coming to a comfortable end range, so I don't want you to crank yourself all the way back. You should be able to smile at the end of it. Okay. Here, another deep breath in. Exhale. Sink back just a little bit more. So it's 2 movements for a repetition. So just go over it again really quickly. Breath in. Go over the comfortable end range. Another breath in. Sink back slightly more. So as I'm doing this, I'm feeling some good pressure build up in my lower spine. That's okay. A little bit uncomfortable as we do it, but really focus on how we're doing after the movement. So let me rotate this pad a little bit so it doesn't slide off on me. Yeah. Set up, so big deep breath in before you move. And then exhale as you're falling back. Good. Scoot your heels back maybe 2 or 3 inches. Yeah, perfect. Good. Nice and done. You're going to come up, reset, keep your back in contact with the pad. Repeat that 9 more times.
Kristen, okay, you're gonna go ahead and relax. I'll be back.
Okay.
All right. Okay, so we did these thoracic spine segments. The retrospinal groups associated with them. I focused on this area here. She had a little bit more tension, and I focused on the right trap a little bit more as well. She had tension in that system. With elevator's cap, upper trap, her retrospinal group. Did low back, and she had tension in her low back, especially lower lumbar on the right side. Her QL, her retrospinal TL junction, and then her left side QL as well. Okay, thanks for watching.